The act that I'm advocating for is titled the Heads Up Act, which focuses primarily on individuals with intellectual and developmental disabilities, otherwise known as IDD, and their access to healthcare services. So, according to an article written in the AMA Journal of Ethics, it was noted that adults with disabilities are 4 times more likely to report their health to be only fair or poor than people with no disabilities. Additionally, the co-authors of this article gave their own professional insight, currently working as medical doctors, and admitted that across the lifespan, patients with disabilities experience a patchwork form of uncoordinated healthcare that leaves them without adequate access to essential healthcare services. So, not only are these individuals with IDD reporting their health to be fair or poor more than people without disabilities, but they don't even have proper access to organized healthcare services in the first place. I believe every individual is worthy of ethical and accessible care. And passing this law would offer greater access to new primary care and specialist services for these individuals. If the law is passed, it states it would open more than 25 government programs for the population across agencies in the United States. Also, the passing of this law would open avenues for expansive research and provide greater reimbursement rates for providers treating individuals with IDD. The conduction of research could lead to new discoveries of treatment practices for individuals with IDD and potentially improve practices that have been utilized before in the past. And the improved rates for providers could offer an incentive to go and serve the underrepresented population too. So, in conclusion, I think the passing of this law proves to be beneficial for both individuals with IDD and physical therapists. It creates opportunities for physical therapists to branch out to these underserved areas and supply quality, specialized care for those facing health disparities with limited options to healthcare. It allows for the generation of new research and authorizes favorable reimbursement rates for physical therapists too. My hope is that this act is truly considered and eventually passed, because I do strongly believe it could positively impact everyone involved in the healthcare system.